Okay, so I think we should make a start. Welcome, everyone. My name is Andrew Weeks. I'm an obstetrician at the Women's Hospital, and I'm president of the LMI here. You're all very welcome. It is a fantastic building. We're going to play a little bit of a game later on to try and spot the McFarland ancestors, who apparently are hanging somewhere here. Because this is part of a program. We've been running a program. The president gets a chance to run a program every year. And so as an obstetrician, it's been my pleasure to run a series of 20 lectures over the year, all called Bringing Life. And it's all related to maternity, related especially to all the cultural changes which are going on through the year. And people may have seen or may have a program, but it's also online. These are free to join, and feel free to join any of the remaining lectures. What have we got? Six remaining, and to tell other people about them as well. Tonight we've got Jonathan McFarland who's come, which is a delight that Jonathan's come to us, in fact, from Spain. So Jonathan is associate professor in Barcelona. Now I'm going to probably mispronounce this, at the Pompeu Fabra University. Is that okay? Is that good enough anyway? And also at Universidad Autónoma. But Jonathan's particular specialty is on the doctor of as humanist, and is president of that organization. And in fact, that fits very well with a lot of the current talk around maternity at the moment, because I think one of the criticisms is that some of maternity has lost its humanism, its humanity within it. So I think this fits very well into the program that we've got. I was very happy that to have read and it's available, Jonathan's book, Humanism in Surgery, which is fascinating actually, and has got interviews with various surgeons about how humanity comes into their work. I mentioned earlier that we're going to play Spot the Ancestor, because I think now this is quite a medical family that you come from, don't you? So apart from cousin Rachel here, who's my colleague at the Women's Hospital and is a consultant obstetrician there, we also have Brian McFarland, who was president here in 1956. And who was professor of orthopedics and president of LMI. And then also Andrew Reid, who was a consultant in ophthalmology, who was president just 2 years later in 1958. So there's quite a family place, and it's very nice to welcome the family back. And I'm happy that we've got some relatives here as well. So enough of me wittering. Jonathan, please come up and give your lecture. At the end, we'll have a chance for questions. There's also people joining live online, and so I'll keep an eye on questions coming from there as well. Jonathan.
Thank you very much. Well, as Professor Weeks said, there is a bit of a family connection here. So this is why it gives me I'm absolutely honored and privileged to have been invited by Professor Weeks, and also through the help of my cousin Rachel McFarland, who is, let's say, flying the medical banner for the McFarland family here in Liverpool. I am devoted to trying to restore the humanism into not only surgery, but just working. Okay. There. So is this? I don't think it's working. Sorry, it's just... So yeah, so it's not only surgeons, but I'm going to speak about humanism in surgery, but I want it to include all doctors, all medical practitioners. And I'm very honored to be part of the gynecological women's health group. I think I'm very, very happy to be part of the Bringing Back Life. I think it's it's a beautiful, beautiful theme. But let's start with some poetry, as I am not a doctor. And let's start with Emily Dickinson. Surgeons must be very careful when they take the knife. Underneath their fine incisions stirs the culprit life. This is something which is not always remembered, that the patient is a person, the patient on the operating theatre, in the hospital bed, in the GP's consulting room. And so this is the number one I want to impress on you all. Secondly, I'm going to start with the family connection. So the drawing of the hands on the right is actually my father operating. And I think in the Royal Liverpool, I'm not 100% sure, and by an artist called Dorothy Bradford. No, I use it, it's okay. So I wanted to talk about entangled lives and how generations overlap and generations intersect, and generations aren't like the stacks on the right, the piles. No, 1, 2, 3, 4, 5. No. And this is Tim Ingold. Tim Ingold is an anthropologist working in Aberdeen. And I just love this idea of the threaded intersections of the generations, and in my case, the generations of doctors and surgeons. And then it reminded me of Jonas Salk, who everybody knows was the founder or the discoverer of the polio vaccine. But what I don't remember always is that he said he wanted to be remembered as a good ancestor. Number one, he wanted to be remembered as a good ancestor. So this is kind of fits in with your theme, Andrew. No, still not working. Okay. So I'm going to try to speak for 40 minutes. I do have sometimes a problem in terms of when I start speaking, I like to continue. But I'm sure the president here will keep me under control. I'm going to speak about medicine being at the crossroads. Humanism is a big word, big theme. The idea of rehumanizing. Is very important because medicine in the past has always had this humanistic approach. Compassionate care, the book, Humanism in Surgery, and then a few take-home messages. Siddhartha Mukherjee, who is a hematologist and an oncologist working in the States, and he's written a lot of books. He's written a book on the gene. He's written a book on the history of cancer. And this is from 2017. And he's always in sync with the humanistic side of medicine. One of the challenges of the new era of medicine is how to retain what we used to call the art of medicine, how patients are treated individually, humanely, humanistically. Let's go back further. We're talking about ancestors. We're talking about the overlapping of generations. So we go further to the 1980s. Edmund Pellegrino was a very famous bioethicist, medical humanist, working in the States. And in actual fact, in Georgetown University, you have the Kennedy Institute of Ethics, which is named after Edmund Pellegrino. And he was worried in the 1980s about the increase in technology. Now, beware. I'm sorry, I will completely I will be honest. I am no technophobe. I think the technological advances in medicine, and I suppose in gynecology, in obstetrics, and all angles of medicine have been incredible. But we need to temper this. And he was already beginning to worry about the, let's say, the imbalance between the technological side and the humanistic side. Another topic he was worried about is this cure versus care. And something I want to go back to, and if there's a theme that might, another thread, let's say, another thread of the intertwining rope would be this. You can't always cure the patient, but you can always care for the patient. So he was thinking about that in the 1980s. Then medicalization, lack of time, over-specialization, which has its good points, obviously. Specialization has incredibly good points. But I'm more than my little finger. I'm the whole person. And sometimes in the medical system, things do change. Let's go back further. There's a kind of a beating, like a drum. That's probably the timer saying you're going over time or something. Let's go back further. William Osler was, they called him the father of modern medicine, and an incredible internist, an incredible thinker about medicine. He's famous for his quotations, for his aphorisms. A good doctor looks after the disease. A great doctor looks after the patient who has a disease. So he always had this, let's say, this approach to looking after the whole person. And he said 100 years ago, twin berries on one stem, grievous damage has been done to both. Regarding the humanities and science in any other light than complemental. They've always been together, historically, always. So this is why I like to use the word restoring, rekindling, renewing. So, I don't want this to be like a family story, but it is a family story. And Andrew Mackay-Reid was my maternal grandfather. I was wondering whether you could pass me the book. Thank you very much, Andrew. Thanks. Now, Andrew Mackay-Reid was president in the 120th session. I think now we're in the 186th.
Something like that.
Something anyway. So we're talking about, a long time ago. He was, I did meet him. He was an ophthalmologist. I didn't know, I was 7 when he died, but he was also, I would say, a well-rounded man of culture, a fine art, a collector of fine art, a collector of fine wine. And I just want to read a little bit about what happened to my grandfather in the First World War. And he was in the second battle of the Somme, I think it was. Be with me for a second. Okay, he wrote this in 1964, which curiously enough is when I was born. So, but he wrote it well after the event, and it's very interesting. I lost consciousness, and then came to, and felt my breeches filling with blood. I thought the subclavian artery had gone, and I managed to roll over, tear open my trench coat, tunic, and shirt with my left hand, and saw and felt blood spurting from the cavity round the fold of the right axilla. I plugged the hole with the third finger of my left hand, and there it remained for 2 days. My life, or soul, or spirit, call it what you will, became dissociated from my body, and from a height of 5 feet, I looked at the helpless body below me. I read that because he brings in an element which I think is very important in medicine, and it's the spirit or the soul. Medicine needs to rekindle the soul, and the motto for the Doctors of Humanists is bringing back the heart and soul to medicine. But what is humanism? I don't have time to explain or to give you my ideas what humanism is, but I think we need to go back to the Romans, to the Greeks. We always need to go backwards. We always need to go backwards in history to be able to go forward. This is one of my feelings. If you don't look back and learn from what's happened, how can you go forward?
Like a bow and arrow.
Like a bow and arrow. Yep. So Cicero, I think he said, without books on your shelves, you're missing something. It's this idea of, as I said before, the well-rounded person, the person who brings to the equation this in-depth knowledge of what's happening around them. And I think of humanism of being attached or having different angles or different lines, ethical, and it's in the case of gynecology and obstetrics, ethical issues are really important. Empathy and compassion. Humanities are the, let's say, the disciplines, anthropology, history, literature, the arts, visual arts, but human being. The term humane. And I find it very interesting, but I read an article from a journal of veterinary surgeons, and the veterinary surgeons were very adamant about the term humane. And sometimes I think that, with all due respect, because I know you're all medics around here, but please, sometimes you could learn from the vets how they treat not only the patient, but the owner of the patient. The term humane encompasses the best qualities of humankind, including kindness, tenderness, empathy, and compassion. Iona Heath, who I know one of the members in the third row is a colleague of, or was a colleague of Iona Heath, Katie Gardner. Iona Heath is an incredible woman. She used to be the president of the Royal College of General Practitioners, and she's written a lot about many different topics. She's written a book about death and dying. She's written a book about John Berger. John Berger was the famous art critic, The Ways of Seeing, who wrote the book The Fortunate Man, which is, Iona Heath said that every medical student should read. And Iona Heath's words in this article, which is also a presentation, I think are very important. Most physicians are not scientists. Now, if I say this to students, who of you are scientists? I'm a scientist. Perhaps, but not a pure scientist. Medicine is the science, or the uncertain science. Why do I say that? Because you're dealing with people. And people have a lot of fallibles, foibles, different ideas, different feelings, it's not a pure science. But she goes further. There's a rift through every consultation. On the one side, evidence has a huge part to play, assuming it is free of bias. Assuming. And on the other side is a substantive role for humanity. Arthur Kleinman, a psychiatrist, says, and this is also a beautiful quotation, physicians are poised at the interface between scientific and lay cultures. Now, this means that physicians and surgeons and medical professionals have a beautiful, beautiful privilege. But with a privilege, you also have a responsibility. And this responsibility is like the counterweight to the privilege. Just going to have some more water. By the way, you can interrupt me, and I'm very happy to take questions during the speech. In actual fact, if you think, oh, he's going on too long, do ask me questions during my talk. David Kapas is a psychiatrist working in Seattle. He's also very interested in what he calls the counter-curriculum of medicine. When he was studying medicine in Chicago, I think, I'm not completely sure, he felt very disillusioned and thought that maybe they were teaching him important things, but they were missing out on other things. So he talks about the counter-curriculum. And he wrote this book, Rehumanizing Medicine. Now, the beautiful thing about this book, not only is the book itself, but when I started The Doctor as a Humanist, he didn't know me, but he sent from Seattle to Spain his book, Rehumanizing Medicine, with a little note saying to Jonathan, I'm really happy to meet somebody else who's trying to rehumanize medicine. And since then, we've been good friends and we collaborated a lot. And one of the things he talks about, and I try to instill and try to push into the students. This morning I had students online from Barcelona, and one of the things that David Kapas says to these students is, you need to look after yourselves. You need to have moments of micro-compassion for yourselves. Doctors are working under incredible... How am I doing for time, Andrew?
No, that's all right.
Okay.
All good.
Just tell me, keep me under control, please.
I suspect that's not possible.
So, doctors, everyone need to care for themselves. If you can't care for yourself, you can't care for others. And this is one of David Kapas's great messages. So, humanism in medicine, what are the possible benefits? There are many. Develop critical thinking. Learn to cope with uncertainty. Physician well-being, resilience. Since the pandemic, this has been even more important. Empathy, emotions, compassion. Okay, the next side. This is the side where Rachel's also a part of the McFarland. I was going to say clan, medical clan, but this is Brian. Dynasty. That sounds better. Yes, I like dynasty. Brian McFarland was a student of Robert Jones. Now, Robert Jones was the grandson of Hugh Owen Thomas, who I think was one of the Anglesey bone setters. So what people don't realize is orthopedic surgery comes from the bone setters. So they used to, excuse me if I'm incorrect, but they used to break the bone to reset the bone. So that's where orthopedics come from. And Robert Jones is kind of like the father figure of orthopedics. Liverpool, by the way, I don't know whether still now, but Liverpool had the most important school of orthopedics for many, many years. So my grandfather was also the vice president of the Royal College of Surgeons of Edinburgh. And he was devoted to children's orthopedics, especially to rickets in the 1930s in Liverpool, when Liverpool obviously, Liverpool's changed a lot, but in the 1930s, there was a lot of poverty. Still a lot of poverty now, but there's a lot of children suffering from rickets. But he also traveled around the world. And I have a little anecdote, which he died in 1961. I was born in 1964. And in 1995, on my honeymoon, I broke my leg, or more or less broke my leg. I don't know what I was doing, but I think I was trying to impress my wife. But we'd already got married, so why did I need to impress my wife? We arrived back in Madrid, because we were living in Madrid. And we went straight to Gregorio Marañón, which is the big hospital one of the big hospitals in Madrid. An ambulance came, it took me to an orthopedic surgeon. And the orthopedic surgeon says, "McFarland, are you the son of?" I said, no, impossible. I think I'm the grandson of. So that was more than 30 years after he died. Compassion. It's all about compassionate care. Compassion for yourself, but compassion for others. And it's very interesting, the difference between empathy and compassion. Empathy is when you're feeling for the other person. In English, we say you're in the shoes of the other person, but in other languages, in Spanish, they say the skin of the other person. And compassion is when you act on that empathy. And this is what doctors need to do. They need to be able to, and surgeons, because a good surgeon is a good doctor first. I was asking my cousin, "Are you a doctor or a surgeon?" She said, "I'm a doctor." Yes, a good surgeon is a good doctor. That's why I'm talking about doctors, surgeons, all healthcare professionals. They need to act on that empathy. And this is being seen around the world. And I think that this is why I'm so excited to be invited today, because I think there's a movement now for the reintroduction of humanism into medical education and medical practice, the reintroduction of compassion. This is published last year in the Royal College of Surgeons of Ireland, the Handbook of Compassion in Healthcare. It's fascinating. It explores the concept of compassion in medicine, offering a practical approach for healthcare workers. It's fabulous. It's a very, very clear, insightful handbook. What are the benefits? I really want to emphasize the fact that compassionate care benefits the patients, but benefits the healthcare professions. This morning, talking to the students in Pompeu in Barcelona, and they're 19, 20 years old. And we were saying, or the other professors and I, who are philosophy professors from Bucharest, and they say, if you need to hug the patient, if it's the moment, now, you need to know when it's the moment. But this hug will help not only the patient, but it will help you. Because it's a mutual. Another book I would highly recommend to all of you, and now I will drink my water. Compassionomics. You've probably heard of, omics now is quite genomics, etc. But Compassionomics is a really interesting book that gives scientific data for the importance of compassion. It's not only something which is like a soft skill. I hate the term, soft skill. The humanities or compassion is a soft skill. The real work is the technological techniques, etc. No, they're both important. But there is a preponderance now, or let's say a push, and I understand it completely, but I just think it needs to be balanced a little bit more. And let me just say that these are things that I'm thinking about all the time. I even asked the taxi driver, what makes a good doctor coming here? And he said, I want a doctor who listens to me and understands me. And this is the key, this balance. And I was speaking to Professor Manuel Pera, who's a surgeon. an excellent surgeon, excellent teacher, excellent vocational surgeon. He lives for operating. Sometimes we worry about him because he works so hard. He goes to see his patients on Sundays all the time. And I said, what do you think about the difference between science and art? And he said, science can help us treat and even cure, but the art helps us to care. And I thought that was a beautiful way of putting it. These are just articles which I think are recent. This is 2025, Surgery with Compassion. And they talk about the 4 C's: conscious awareness, courage, commitment to purpose, caring, connections. But let's not only talk about the doctor-patient relationship. The system, the healthcare system, is under, or has been, or is always, seems to be, always in a crisis. The National Health Service, which is the Spanish Health Service is based on the National Health Service in England. But it always seems to be in a kind of moment of stress. So we also need to think about compassionate leadership. And this is an excellent book by Michael West, who's working in the King's Fund. And I'm involved in this push to bring compassion. I'm going to use the metaphor again, like a thread through the whole system. He talks about attending, understanding, empathizing, helping. It's necessary. We're not going to change the world, but we must make the systems more compassionate for people to be able to work with compassion within those systems. Now, this was based, Humanism in Surgery, has been a book which has kind of been in the back of my mind for many years. And in 2022, I think, around the time of the pandemic, we put on a conference in Oporto about humanism in surgery. We actually had, we invited the now present first female president of the Royal College of Surgeons of Edinburgh, Claire McNaught, and she gave a talk, and now she's just become recently, about 6 months ago, even less, the first female president in Scotland. And it was a big success. And so the book came from this. And we're very happy with the response, because I feel that this counter-curriculum, this movement to restore humanism to medicine is beginning to take hold. Beginning. The seed is there. And Gavin Francis, who you might know, a very distinguished writer, who's written Adventures in Human Being. He's just written a book about mental health, which is beautiful. It's called The Unfragile Mind. I'd recommend it to anybody. He wrote a review in the Royal College of Surgeons of Edinburgh. And surgery is profoundly concerned with humanity, with the practical hands-on realities of easing suffering and postponing human death. However, should it be concerned with the humanities, that is, learning of literature concerned or literature concerned with human culture? The dictionary definition of humanities goes further, setting out literature, history, art, music, and philosophy as its constitutive elements. We expect surgeons to be highly trained pragmatists, gifted with elite technical prowess, but should they also be concerned with human culture and ideas? And Abraham Verghese is another writer I would suggest you read. He's another medical doctor writer. And he says, surgeons are not just technicians, but healers. And this book deepens the appreciation of what every good surgeon and doctor knows. True healing requires more than science and sutures. And we have another fabulous review from a journalist in Montenegro. Her name is Maria Bolevic. And she contacted me. She said, can I write a review of the book? And I said, yes, of course. And she wrote it in 2 languages, in English and Spanish. And it's beautiful. Every day a new book may find its way into your hands, but this one is different. It weaves, we have the same metaphor, together science, medicine, art, communication, and technology, all centered on the human being and the surgeon. Whether read in airports, waiting rooms, classrooms, the book leaves readers with a lasting impression. In the end, we all seek the same thing. And this goes back to the taxi driver. To be seen, to be heard, to be understood. Surgery is a highly technical field. But this doesn't take away the fact that we need to balance the technical angle with the humane angle. And now the word calling. This is a difficult word, or vocation. It's a difficult word now. We're a little worried in Barcelona, I suppose, now with the students, some students and young doctors maybe don't feel medicine or feel the practice of medicine in the same way. Because the profession of medicine, and I can speak kind of out of the box, because I'm not a doctor, but the profession of medicine is not like any other profession. You're dealing with somebody who's suffering. You're dealing with somebody who is scared, disenfranchised, let's say, vulnerable. The vulnerability of the patient is well, I can speak as having been a patient, and you're completely helpless sometimes and vulnerable. And so you need the support of the professional. You need maybe just a touch, a word. Caring for versus curing. My nurse had an aneurysm at about the age of 46. And she had a big operation on the brain. But she spent a lot of time crying in her bed. And she said to me, all she wanted was somebody to go up to her. All she wanted was the presence. And the presence of the doctor, the presence of the surgeon. I'm going to briefly touch on this. I don't know. I think, how are we doing for time, Andrew? What's the time?
It's 22.
Okay. I'm going to go a bit more quickly. This is a chapter that I wrote with Manuel Pera, professor of surgery in Barcelona. And as you can see, we're in a fabulous place. We've got William Osler between us, and this is Johns Hopkins. We wrote The Word and the Hand. The word is the key to the contact established between those who need help and those who can help them. J.M. Little says in The Ethics of Surgery, surgical procedures leave scars both on and in the body and in the psyche. The last skin suture is not the end of the surgical story, nor does it end with discharge from hospital. And then Abraham Verghese again, touch is so much more than touch. You have gnostic touch, you have pathic touch. Pathic touch is just, if you touch the other person, there's this reciprocity, no? Because when you touch, you're being touched. And the pathic touch is helping. And also this, the idea of the physical examination, which I'm not going to say is going out of fashion. Well, maybe it is. I had another friend who was a maxillofacial surgeon, and he was the head of the department, and he had a heart problem. He went into his own hospital. The young doctors didn't know who he was, but they didn't take a clinical history or even touch him. The patient needs for the surgeon's presence throughout the illness and beyond, because this presence is what elicits trust. And trust is essential for the well-being of both. This is, another beautiful painting. This is Goya, Francisco Goya, and it's a self-portrait with Dr. Arrieta. Now, what's beautiful about this, Goya recovered, and he left the painting to his doctor in his will. So the doctor was lucky enough to have a Goya. I'm going to go through this. Why is humanism so important? Perhaps doctors, surgeons, in close contact with individuals who are suffering, have the privilege and responsibility to care for these individuals, are ideally positioned to explore the intricacies of what it really means to be human. And there is hope. And these are just some of the initiatives that I'm involved with, the New Paradigms in Healthcare, which is a series, Humanism and Surgery. We've got a book coming out this year, which is about towards an ecological health humanities. We've got a book coming out very soon about the pharmacist and the patient, the relationship between the pharmacist and the patient. The doctor as a humanist is restoring itself, is coming back. And in Pompefabra, we have a summer school, the first summer school, Humanism in Medicine. In Pompefabra, we'll have Gavin Francis, Michael Atkinson from Sunderland, Leslie Liao from McGill. We'll talk about global health, planetary health, and we will use beautiful parts of, we'll use the Royal Academy of Medicine of Catalonia, which is the Gimbanat, which has an operating table from 1740. It's incredible. My take-home message is the following. The science of surgery treats, the art of surgery cares. And let's get back to the generational and the ancestral. And my great honor, privilege, and luck to have been born into the family I was born into. And this is a poem which my father wrote. May each day dawn clear for you. May each noon's repose repose you. May the softness of each evening gentle you. May each night your dreams bless you. So I dedicate this talk to my father, John Brian McFarland, who some of you know in the audience, but to really all present future doctors, surgeons, and healthcare practitioners. Thank you very much.
Thank you so much, Jonathan. Don't go away.
I'm still here.
There's time for questions. Questions? Well, maybe I can start. In COVID, in the time of COVID, there was a very great disconnect, of course. So the art and that humanity was taken away. And that's also happened with the advent of computers. We've also had that problem with computers, with electronic health records, where you're walking into the room and then you're tapping away and your password is gone, and it sort of disconnects you, really. And I wonder whether you see technology as a hopeful change, or whether you think it just makes things worse. Because I dream of a day where actually you can walk into a consultation and you don't have to take any records. Somehow it's collecting, it'll transcribe it, it'll happen. And you actually reconnect. You're not writing in the notes anymore. You're not doing all those things. You're focused purely on what you can do and what AI can't do. But it could go the other way, couldn't it?
The question's a fantastic question, Andrew. And I have to be optimistic, let's say.
Okay.
I have to be optimistic because I think artificial intelligence is here to stay.
Yeah.
And we need to work with it, not against it. And so we need, as you say, the artificial intelligence can take the notes, the patient notes. And this is fantastic because then you can also, I think it's very important, the positioning. of the chairs. And this computer is a barrier. In some hospitals, some places, the computer is between the patient and the doctor. In Spain it is, right? In England, I think, no, maybe you sit together, but it's also this the posture, where you're sitting. But I'm optimistic pessimist.
Okay.
So I think that probably, or we need to teach the younger generations to use it in the benefit of more humanity between doctor and patient. There might be questions online, I don't know. Chat. There's a few things in the chat.
How would Brian McFarland think about your whole humanistic approach in medicine?
That means Brian or John?
It says Brian.
Brian. Wow. Who asked that question?
Oh, no. See you later.
You know, I hope that my grandfathers and my father would be very proud of me, because I do it with enormous love. I think medicine is love for the other. I think Brian was I never met him, of course, was a very compassionate man. He had his McFarland foibles, let's say, but he was a very, very great person with children, really good with children. So I hope, whoever asked me that question, I hope he would be proud of me.
Do you think it's part of the legacy? Do you see yourself as upholding that legacy and with Rachel as well, keeping their particular skills alive?
Well, that's also Rachel has more qualifications to do that, and I'm passing the banner to Rachel McFarland, because it's very nice to have a medical McFarland in Liverpool. Because, but I think so. I think I was brought up in between the lay cultures and the medical cultures. I used to go to the hospital in the Royal Southern at Christmas, and when I was about 6 or 7. So yes, I think so.
Okay. Well, I'm sure that they'd all be very proud. Andrew.
Firstly, many congratulations on a fantastic talk.
Thank you.
Are you going to leave us a reading list?
Yeah, I'd be very, very, very happy. I mean,
people online may struggle with hearing.
My main question, it comes down to empathy and compassion, how we should teach it. I've been examining some young doctors recently, and they all say the same words. And it's almost like watching bad acting with no meaning behind it. And I don't think we're getting it right. So how do we go about it to put it right?
You know, I think one of the problems is how students come into medicine. What's the reasons they come into medicine? I'm not so sure about England, but in Spain, students go into medicine because they have the grades. And so you do have students in the first, second year who I say, why are you studying medicine? And I don't know. Well, I know, because they have the grades to get in. So that could be one of the problems. Whether you can, another point, which I'm sure you'll agree with me, is the idea of the importance of the mentor. So if students and residents have the influence of good mentors, good examples, but also bad examples. The other day with we had sixth-year students in Barcelona, and two of them said there was one doctor who we were horrified by how he treated both the patient and us, and they won't forget that. So I think the system needs to be changed in some respects, and we need to admit students who are really dying, I'm sorry to use that word, but really want to be doctors. And maybe we're not. And then we need mentorship, I think. I don't know if I've answered your question.
I think you've answered it very well. Thank you.
Thank you. Thank you.
So we've got a couple of questions at the front, please.
Tell me who you are first, and then.
Thank you. So you talked a lot about reintroducing humanism to medicine. Given kind of the current state of NHS and the burden that's on doctors and nurses and how little time there is, with GP appointments being barely 10 minutes, what small steps can we take to reintroduce humanism? Are there small things we can do that don't take much time because we don't have much time with patients anymore, that can really show that we are listening to them and have compassion and care?
This is a beautiful question, and I'm going to try and demonstrate this. You might have little time, but you can do little things. So I don't know if this door is open.
I'll go take the microphone with you for those.
Oh, right, yeah, sorry. I thought, thanks, Andrew.
Can we just?
Yeah, can I grab your microphone? Okay. I think you can use micro moments of compassion. So first thing you can do is you can get up from your seat, you can open the door, and you can welcome the patient in to your consulting room. Secondly, you can sit down next to your patient and you can listen to your patient. There is a terrible statistic that something like after 11 seconds, the doctor interrupts the patient. But you don't need to do that. You can just listen. I think you've got to make time, and you've got to make the time quality time with the patient. I think there are little things you can do. You can ask the patient about, how's your family? These do make a difference. You can touch the patient when it's appropriate. Just touch on the shoulder. Little things make a difference, but it's a big problem. I'm not getting away from the fact that it's a very big problem, but I think you can do little things. The little things make a great difference. Some kind words, kind gestures. I hope I've answered your question, because it's not easy either.
Yes, you have another. Do you want to?
I'll stay here.
Yes, I'm Adam Hall. I'm not a healthcare professional.
I think I recognise you.
I've known for a long time. A similar question to guy in front here. I saw in your presentation the word time cropped up, and that got me thinking, how could we convince healthcare professionals, hospital managers, those that manage the whole process of giving good healthcare, that time should be given to physicians to enable some of the amazing things that you've talked about today, so we can actually see the benefits of some of the things you've been talking about, making an influence on patient care?
Well, thanks very much for the question, Adam. I think one of the things that Andrew said about the artificial intelligence, if it's used in the right way, this can give time to the doctor. Secondly, a good doctor will spend the time necessary with the patient. Another friend of mine is Professor Kher, pulmonologist. He says in some hospitals there's a clock saying, you got 5 minutes left. He says he doesn't look at the clock. If the patient needs 30 minutes or 40 minutes, he spends the time with the patient. I think also you've hit the nail on the head, both of you as well, because the system is not helping the physicians or the patients. So this is why it's very important to have this compassionate leadership. So it's very important to have it going all the way through the system. But I think a good doctor will spend the necessary time with the patient. They know that. But it's a great question, and it's also very difficult to answer. I hope I've answered.
I worry, Jonathan, that accountants are probably ultimately running the time.
Wow.
Clock.
Let's talk about that later. Not now. Let's talk about that later. Or the lawyers.
Come to you in a second, Derek. We just had another question at the side there.
Is it working?
It is.
Yeah, perfect.
The word imagination springs to mind somehow. A very visual thing, imagination. And you mentioned Goya. It seems to me Goya really was the great understander and empathizer of the human condition. And I wonder if we ought to study the fine arts more, Goya in particular, perhaps.
That's a beautiful question. That's a beautiful question.
Statement, really.
No, but statement. But I completely agree with it. One of the questions I ask at the beginning of the course with the students is, what makes a good doctor? And one of the words or the qualities I'm hoping for is imagination, creativity. And we are beginning to use the visual arts in medical education. It started in the States and it's coming here and also coming to Spain, because in the summer in this course we're taking students to the National Museum of Catalonia, and an expert, one of the expert in visual thinking strategies, which comes from the MoMA in New York, and basically it's helping the students observe and interpret, yes, and reason, and critical thinking is the key. But imagination, yes. In the first year we had the elective in Barcelona, one of the newspaper reports says, does teaching Tolstoy make better doctors? And probably the answer is yes. I love that question. I love that, or statement. Yeah.
Thank you. Yeah.
Jonathan, thank you very much for that lecture. It is very rare that I go to a talk and I agree with almost every word. But on this case, you hit a whole lot of nails on the head. But I could ask you or talk about just about every issue that you've mentioned. But I want to go back to this business about time with patients. I used to say to colleagues, who runs your clinic? And they would say, oh, well, there's a clinic manager, there's this, that, and the other. I would say, no, you should run your clinic. You should organise your time, which is exactly what I did right throughout my career. And the reason I did it was because patients needed time. Now, was I an inefficient doctor? Could I have done a lot more work? Well, I could have done a lot more useless work by seeing a patient for 5 minutes, sending them away, bringing them back in 3 months, then another 3 months, and another, etc. My philosophy was always, you spent the time necessary with the patients, you sorted them out, and you discharged them. And I spent my whole career, both as a junior and as a consultant, discharging patients and actually challenging other doctors, why you brought that person back. And interestingly, the patients who are discharged are really grateful because they don't want to keep on coming up to the hospital, but they do need the compassion, which is, I can't do any more for you at the moment. If your situation changes, I'd be very happy to see you back again. So you give them the opportunity to come back. But I really do think that the medical profession has to take charge of its own activities and not be bullied, cajoled, etc. by numbers and so on, because it isn't as efficient as the bean counters think. Thank you.
I completely agree with you, and I take my proverbial hat off to you. The continuity of care is very important, and there's lots of studies about this continuity of care. Especially in Scandinavian countries, and I appreciate your experience and what you did with the patients, and I think this is a question of the mentor, no? The good role model. I think is also very important.
We just had another comment to that. Well, this business of rapidly seeing patients means you miss things, and I remember as a registrar, I picked up 2 patients who had colostomies, and over the period of years, It's a change from this is a temporary colostomy to this is an irreversible colostomy. And both of them had the colostomies for 4 or 5 years more than they needed. It was only when I went back and went through the notes properly that you find out, oh, hang on. And then you actually give them proper service rather than just see you back in 3 months.
True.
Thank you.
One more question.
Was there? Yes, please.
Thanks. A really, really fascinating talk. My name's Naomi Walker. I'm a medical consultant. I was just going to make a comment about continuity of care.
All right. Okay.
So you beat me to it. And I think perhaps that's something that's getting degraded in our health service, particularly in hospital medicine, where shifts and rotas mean that you'll see someone and then you won't be the same person that sees them the next day. But during your talk, I was also thinking about the continuity of the educational relationship in medicine as well, and the fact that student placements are often very short and they don't always get to spend a lot of time with one specific educator. So I think the mentoring role is really important. So thank you.
Thank you very much for those comments, because yes, continuity of care I think is essential, not only in the hospital but also with a GP. You don't see the same GP always or ever. Yeah. Another question. Any more questions online?
So we've answered quite a lot of them as we've gone on.
I just wanted to, reinforce the thing about continuity of care, because I was a GP for many years, and actually there's that thing about looking after yourself. When I think back about my career, there are lots of good things and bad things, but the things that really I think got to my soul was when it was when there was continuity of care and I did know the patient well and I was able to empathise and I just want, and so I think that's important, and I think that I'm hoping that there's a move in primary care. It's so difficult now because there's telephone consults and all this, but I think there is a movement for trying to bring back continuity of care.
Yeah.
And just one more thing, in terms of the small tips, I've got a medical condition which is very annoying. It's not visible, and nobody understands it very well. But anyway, I spoke to a GP today on the phone, and the thing that I've spoke to different people, and they give me advice, and they do this and that. This GP, when I said what the issue was today, she actually there was a moment of silence. So I could tell on the phone that she was listening to me. And then after that, I don't even remember what she actually said, but I got that feeling that she was actually listening and really understanding. And it was just that second, she didn't come back to me straight away and say, oh, it's all great, or you do this, or there was just that flip. And I think that's just taking that second of time or 5 seconds can make a difference.
I love that. I love the idea of silence. And another thing, we were talking to the students the other day, or Manuel Pera was saying, don't be scared of silence. Silence is part of the language. And then I was thinking, last night we went to see Waiting for Godot, Samuel Beckett. Samuel Beckett knew about silence. Silence is really important. And sometimes people are worried that there's no talk, because the silence is really important part, or the pause. So thank you very much for that.
It's maybe a good place to end, because it is 7:05, and we're supposed to finish at 7. But this is fascinating. But it's a good place to end, actually, because it goes back to your taxi driver. Indeed, what do you want? Actually, you want somebody who's really listening. So those micro moments of compassion, I think, is certainly what I'll take away from this. Jonathan, thank you so much. Thank you so much for coming. We do have a small memento to pass on to you, to thank you for your generosity in coming to speak to us, but also to remind you of your time here in the ancestral home of LMI.
Well, thank you so much for this. This is really, really, really important for me. And just the last thing, the last time I was here and speaking was for the memorial of my father, I told you. So it's quite emotional and very, 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 very privileged and honored to be here. And I hold this very dear. So thank you, Andrew.
Thank you. So thank you very much all for attending. What a fascinating evening. I hope those online have been able to hear and enjoyed it, and questions have been coming through, but actually I think they've all been answered, and they're very similar to questions that we've had. So next week we have another lecture, next Thursday, in fact. So the mighty James Walker, Professor Jimmy Walker, is Professor, University of Leeds, but has been central to safety management in maternity care, and is at the heart of what's going on at the moment around safety and around the maternity reviews. And he's going to kind of come along and talk to us next week about what does good look like from the UK maternity services. So we look forward to him next week. This place actually is completely independent from the university. It's independent from the hospitals. It keeps going on membership. Membership is £50 a year. It's free for medical students. We asked consultants in active practice to play a little bit more, as we can do. But it's very good value. So do, if you've enjoyed this evening, do come and join us, be part of this great institution, which is part of Liverpool's history. There are some drinks, a glass of wine next door to be served. We do need to leave out of this room, but if we could go next door, then I'm sure you'd be happy to take some more questions next door. So.
And use Blue Sky, not X, so you can just the Q code there.
Excellent. Okay, thank you very much, and we'll see you next week.